an article on Medscape. The title of the article was, "Are You Gaslighting Your Patients?" I thought this interesting because I've talked about this a number of times. This happens to women more often than men. I get lots of comments on videos and other social media regarding how women feel like they're not listened to. So gaslighting basically is the intentional manipulation of a person's perception, but also the dismissal of the person's legitimate concerns. So that's in the dictionary. So too often doctors are dismissing patients' concerns. They don't believe them. They don't listen to them. They don't want to hear about it. And part of that is because of the way the system is set up. Doctors can't address every concern that a patient has at every visit. They can only do so much in a 6 to 8 or 9 minute visit. And so they have to have the patient come back so the patient feels not listened to. Some doctors just don't want to hear it. They think they know best, and they think that the patients are spending too much time on Dr. Google or the internet, and they don't want to hear what the patient has to say. Anyway, I'm only going over this with you because it actually wasn't an article in Medscape, which is a commonly followed source of medical information and articles in the medical community, in the healthcare community. And I thought it was interesting that it said, "Are you gaslighting your patients?" Directing this towards healthcare professionals, saying, hey, maybe you should start listening better. Let me know. Put some in the comments below. You've been gaslighted? Have you, per this definition, the dismissal or the minimization of a patient's symptoms? I'm Dr. Dave Morris from Magnolia Medical Center here in Murfreesboro, Tennessee. We try very, very, very hard to practice active listening and really understand a patient's concerns at our office. Maybe even go overboard in that regard, trying to understand and make sure we fully get what's going on with the patient. Take care today.